All right, hi guys, a very good evening to all of you, and welcome to our today's session of frequently asked topic. And I think there was some error in the link, that is why we could not use this link yesterday. Today we are going to utilize this one. I hope that all of you guys, those who are going live, will be able to see this. Please give me a quick thumbs if you can see me clearly. If the audio and video both are fine, please give a quick thumbs, all of you. We were supposed to use this link yesterday actually, but we could not use. Yesterday we have used another link, but this is yesterday's link actually that we are using in part 2. So please let me know if I'm clearly audible and visible, and immediately we can start. Okay, thank you very much, Dr. Hashirama, Dr. Muthu. Alright, so in the part 2 we'll be talking about mainly, as I promised yesterday, that I'll take care of topics like central nervous system and cardiovascular system. CNS and CVS are the topic that I will be discussing for today. Okay, a couple of announcements before I proceed with that. I think there is some issue with, let me just fix this. This is a session for around 50 minutes to 1 hour. So we'll be covering this in 1 hour, I guess, more or less. Dr. Aritra Saha. Okay. All right. So let's talk about few of the new announcements that we are having about the upcoming NEET PG batch, the new batches that we have here. The 3-month subscription you can buy at a cost of 9,999, and in addition to this you can utilize the code, as I have announced previously as well, Pharma10, to avail a 10% off in your subscription. NEET PG 2023 Summit batch, it is having 3 modules actually. Module 1 will be emergency room procedure, module 2 is frequently forgotten volatile topics, and most expected question will be covered in module 3. This batch also you can just avail in 9,999. It will be for a 3-month. Rest assured that when you are taking a subscription for 3 months, you will have access to other batches as well. Okay. MBBS Prof subscription. So there is a huge price drop in the Prof 1. You can buy a 3-month subscription of Prof 1 just in rupees 3,000, and Prof 2 in rupees 4,000, and Prof 3 in rupees again 2,900 something. And in addition to this, remember, Pharma10 will be the code that you can utilize to avail the benefit, the set benefit that we have. Okay. All right. So let's start. As I told you that we'll be talking about central nervous system and cardiovascular system. A couple of questions that has been asked in central nervous system is from a topic called antipsychotics. Remember guys, in you have to know how to identify the antipsychotics and also their important mechanism of action. For example, if the typical antipsychotics is acting as a D2 blocker, atypical antipsychotic will be 5-HT2A blocker, right? Typical antipsychotics, they are mainly associated with side effects like your extrapyramidal symptom, hyperprolactinemia, right? And atypical antipsychotics that we have like clozapine, olanzapine, risperidone, aripiprazole, ziprasidone, these are the atypical ones. They will be mainly associated with metabolic side effect, right? Weight gain, insulin resistance, increasing the risk of diabetes. On the basis of that, examiner asked that which of the following antipsychotics is having maximum risk of extrapyramidal symptom. Do remember, maximum risk of extrapyramidal symptom that we have, it is mostly and mainly seen with the typical antipsychotics compared to atypical antipsychotics. Typical is mainly associated. Now in the typical one, the drug that is going to be answer here will be your haloperidol. This is the maximum risk, and in the typical one, the least risk of extrapyramidal symptom that we have, it is going to be the least potent atypical antipsychotics known as your thioridazine. Now when it comes to When it comes to the atypical antipsychotics, remember the atypical antipsychotics usually are known to cause metabolic syndrome, metabolic side effect, but some of them are also associated with these extrapyramidal symptom like dystonia, akathisia, right? So which one among atypical? There is a risky drug among atypical, and I call this one as a risperidone. Now why do I pronounce it as a risky drug? Because being a atypical antipsychotic, it is the most potent atypical. This is the most potent atypical, and it is so risky that it can even lead to your extrapyramidal symptom, hyperprolactinemia. Okay. Then the one that is having least risk, overall least risk that we have, it is going to be your clozapine. It does not have risk of extrapyramidal symptoms. Okay. Atypical that can cause arrhythmias. Remember, the one that can cause arrhythmia will be none other than sertindole. In addition to this one, if the examiner is going to ask you which of the following atypical antipsychotics is known to cause myocarditis, I want you to answer this one. Myocarditis is known to cause by clozapine. That is the next drug that I am going to talk about. Clozapine, guys, it is one of the atypical antipsychotics, and this is among the drug that is having maximum risk of, among the drugs like clozapine, olanzapine. These are the drugs that are having maximum risk of your metabolic syndrome, right? Metabolic syndrome, like weight gain, insulin resistance, increase in the risk of diabetes and all. Okay. But if the examiner is specifically going to ask you that clozapine ka uses kya hai, so one is it is the drug of choice in a patient with the resistant psychosis or resistant schizophrenia. In addition to this, important side effect that is associated with them, right? See, metabolic syndrome is already there. In addition to that, they are also associated with certain other side effect known as your agranulocytosis, right? Agranulocytosis, right? Sialorrhea, which is also given the term as a wet pillow syndrome. Wet pillow syndrome, because of the excessive salivation, the person when he goes off to sleep, right, the pillow will be wet, right? So we call it as a sialorrhea. Sedation, it can even lead to seizure. As I have already told you, one of the cardiac side effects associated with clozapine is going to be myocarditis. Myocarditis is one of the side effects associated also with the clozapine. Moving on to some other extrapyramidal symptoms that we have. Very good evening, Dr. Happily Frustrated. Earliest extrapyramidal symptom, guys. The earliest extrapyramidal symptom that we have is known as your dystonia. Altered tone. The tone will be altered. Examiner asks, okay, if there is a dystonia, how will you manage this? That is another question. And thrice this question has been asked. In 2021, 2022, in both the years, this question has been asked. Okay, so dystonia ke liye, what are the drugs that we can use? Centrally acting anticholinergic drugs that you can use. Drugs like your benzhexol, right? Drugs as your benzhexol, or you can use benztropine. But in the recent examination of 2022, neither of these options were there. So you can also use another drug that are having anticholinergic drug. There are antihistaminic drug having anticholinergic property. The name of such a drug will be promethazine. Yes, Dr. Tanveer, hello. Alright, most common extrapyramidal symptom that we have, it is going to be akathisia. Motor restlessness without the source of anxiety. It is motor restlessness without the source of anxiety. See, your examination, if you are a FMGE student, your examination will be conducted in January. For NEET PG student, it will be conducted in March. But let's say an MC is coming on the screen right now and telling that your examination is going to be conducted after 2 days. That will definitely induce a source of anxiety. Be it a NEET PG or FMGE, if the MC announces that your examination will be after 2 days, what will happen? That will induce an anxiety. And in that anxiety, if you are moving inside your room from one corner to other corner, that's a normal response. Okay, you are anxious and there is a motor restlessness. But after taking the drug without any source of anxiety, if there is a motor restlessness, right, remember there will be akathisia. And the treatment of this one, how will you manage akathisia? The drug of choice for this one is going to be none other than propranolol. Most dangerous extrapyramidal symptom that we have, it is going to be neuroleptic malignant syndrome, right? In fact, death has also been noted with the neuroleptic malignant syndrome. The antidote that we have for neuroleptic malignant syndrome, earlier we were using antidote as okay. Happily Frustrated, please take class on antimicrobials. Yes, in this series I will cover antimicrobials also. Maybe on after, I mean not tomorrow but day after, I will be covering antimicrobial also. Don't worry. Alright, so antidote क्या use करेंगे इसमें? Antidote according to the recent book that we have, recent guideline, it is going to be bromocriptine. In addition to this, we will also be adding dantrolene. Now, dantrolene was the drug of choice earlier we were using. We were using dantrolene and we are still using dantrolene. We can use dantrolene, happens to be the drug of choice in a patient with the malignant hyperthermia. The presentation of this condition was very much similar to malignant hyperthermia. Malignant hyperthermia and neuroleptic malignant syndrome, they were presenting in the same way. But when they did the study, they found out, okay, the cause of malignant hyperthermia is something else. It's not the the neuroleptic malignant syndrome. There is no mutation in the calcium channel or anything. It is the deficiency, excessive blockade of the dopamine that is causing this neuroleptic malignant syndrome. So they're telling, okay, antidote will be this one. 13th edition Goodman-Gilman clearly says bromocriptine is the antidote, right? Atypical with the least weight gain. So again, atypical antipsychotics, बार-बार question आ रहे हैं, तो other questions को भी also let's summarize. Atypical, usually atypicals are known to cause weight gain. So as I told you, maximum weight gain or most commonly associated with weight gain will be olanzapine, clozapine, quetiapine, right? Maximum weight gain, the one that make your figure 0 will be olanzapine. देखिए एक figure 0 बना दिया, like a potato. O figure 0 बड़ा सा. Then we also have clozapine. See, clozapine that we have again एक family pack, जैसे हम सारे इंडियन लोगों का होता है एक family pack, है ना आगे. और quetiapine, Q again एक 0 figure 0 जो बना दे, right? So they are maximally associated with the weight gain. But least weight gain is associated with which of the following drug? This question you can expect. You can remember the name of the drug is aripiprazole and ziprasidone. Everyone who was receiving atypical antipsychotic, they were gaining weight, but they said, "Arey, Shipra ko dekha kya? She is not gaining weight. She is still very slim, right? In spite of being on this atypical, she is not gaining weight. Who is that? Arey, Shipra ko dekha. Aripiprazole and ziprasidone. The one that is causing weight loss. There is no antipsychotic drug that is causing weight loss. There is weight gain. There is more weight gain, less weight gain. But there is one that has shown to cause weight loss in some of the studies. It's a miscellaneous class of antipsychotic. It is molindone. Maximum risk of hyperprolactinemia. So which drug is having a very risky name? Hyperprolactinemia, risky name. It is risperidone. It's a risky drug. Risperidone, it's a risky drug. Corneal opacity and retinal pigmentation. Boys and girls, corneal opacity. See, Dr. Ram Birla. See, it is asking atypical, no doctor? ये अगर typical पूछता तो definitely you would say haloperidol, but among atypical, so you'll have to be very very careful when you look at the question. Corneal opacity and retinal pigmentation, both of them, it is caused by one drug that is known as thioridazine. See, there are so many antipsychotic drugs. The only one that is known to cause corneal pigmentation, it is thioridazine. It causes browning of visits. This will be causing browning of visits. ठीक है, brownish retinal pigmentation. But if it is asked only corneal opacity that we have, who can cause only corneal opacity? That will be other drugs as well, like chlorpromazine. It is also known to cause chlorpromazine. Okay, cataract among antipsychotics is caused by, cataract will be caused by quetiapine. So in the mnemonic we always read quetiapine as a queen, and I say queen was blind, अंधी रानी इसलिए because she has cataract, है ना, cataract, queen, quetiapine, cataract. Okay, remember quetiapine is also known to cause painful prolonged erection, उसको बोलते हैं priapism, है ना. It is, so examiner can ask you, priapism is associated with which of the following? So quetiapine again can cause priapism, painful prolonged erection. So a 2022 का question, as I promised yesterday that I'll be doing some MCQ as well, अभी आया था NICT में just few months ago. A patient on risperidone, a very risky drug, you all know this, came to emergency with fixed upper gaze, right? So dystonia का feature दे रहा है. What is the treatment of this condition? So fixed upper gaze, that means risperidone risky drug है. Extraternal symptom is possible. So what you can give, again as I told you, that promethazine is something that you can use in this scenario, right? Not the metoclopramide and haloperidol, because haloperidol can worsen the scenario. Likewise, metoclopramide is also a D2 blocker. Clonazepam has no role in this one. It's a benzodiazepines. Okay. All right. Another question in 2022, same topic. See, INICT 2022. NEET PG 2022. A patient on cisplatin therapy presented to hospital with several episodes of vomiting. After giving an antiemetic drug, the patient developed Parkinson-like feature. So Parkinson-like feature, again, secondary Parkinsonism. They are still talking about extrapyramidal symptom. The antiemetic drug most likely responsible for this feature. This question has been 3 times asked in AIMS previously, once asked in FMG as well, and 2022 में NEET PG में पूछ लिया. बताइए, which of the following antiemetic drug can cause? Very simple, no? It's a D2 blocker, and this D2 blocker, it can even cross the blood-brain barrier. Now you might be wondering, sir, domperidone is also a D2 blocker. Yes, but it does not cross the blood-brain barrier. Ondansetron can definitely be used, but the thing is that it is a 5-HT3 blocker. It is not associated with the extrapyramidal symptoms like that. Promethazine is used as a management of the extrapyramidal symptom. But examiner is asking which antiemetic drug can cause extrapyramidal symptom. Metoclopramide is the drug here. I hope all of you guys have got this question. 2021, same topic. A patient presented with vomiting and was treated with the antiemetic drug. Later, the patient presented with abnormal movement. See, same topic, 2 question. Which of the following agent to be used to counter the problem? So what you can use? Now you can tell me very easily. Benzaxol, levodopa, haloperidol, cyproheptadine. Agent was treated. So which antiemetic drug can cause this? Possibly metoclopramide, as I told you. It's a prokinetic agent. Metoclopramide, it's a prokinetic agent. It's a D2 blocker. It can cause extrapyramidal symptom. So you will be using centrally acting anticholinergic drug like benzaxol, benztropine, as I have mentioned it already. Let's discuss the next topic that we have. Okay. A patient received halothane and developed increased body temperature and muscle rigidity. Increased body temperature and muscle rigidity. Administration of which of the following drug can increase the risk of present condition? Inhalation anesthetic agent is causing body temperature. So what is the diagnosis that they're talking about here? Are they possibly talking about malignant hyperthermia? Are they talking about malignant hyperthermia? Now, Dr. Meningococcus, listen to me very, very carefully. Examiner is asking which of the following drug can increase the risk of present condition? Isn't that dantrolene is the drug of choice for malignant hyperthermia? How can you say A? A to you cannot say, right? You cannot say. So succinylcholine among the NM blocker. This is having this is one of the depolarizing muscle relaxant. This is associated with the maximum risk of, malignant hyperthermia. There was one question that was asked in NEET PG again on the same, and I'll quickly give you few data here. Examiner is asking most common agent to cause malignant hyperthermia. Overall, सबसे ज़्यादा risk of malignant hyperthermia has been associated with succinylcholine. Among LA, which is causing highest incidence of malignant hyperthermia, the answer is none other than your lignocaine. Inhalational agent, I think we are just discussing about it. Halothane. Okay, halothane. The drug of choice for the treatment of malignant hyperthermia will be dantrolene. Let's quickly talk about few important drug of choices, which is always your favorite. Remember, in the 2022 also they have asked you one question. 2021 also they have asked you one question in the drug of choice in the seizure. Okay, so 2-3 things that you should read whenever you are reading seizure. Read few important ones. Right? Don't forget about topiramate. Don't forget about drugs that are used and avoided in absence seizure. कहीं लिख लीजिए, अगर नोट करें लिख लीजिए टोपिरामेड के बारे में few important thing which I will summarize. Drugs that are used and contraindicated both in absence seizure, दोनों चीजें याद कर लीजिएगा अच्छे से. Then non-epileptic uses of anti-epileptic drugs. I will be summarizing also. See, first and foremost, drug of choices. In an absence seizure, what is the drug of choice that we are going to use? Absence seizure में the drug of choice will be, guys, ethosuximide. Ethosuximide. Can you guys tell me what is the mechanism of action? It's a T-type calcium channel blocker. The site of action will be at the thalamus. In the atypical absence seizure, myoclonic seizure, atonic seizure, clonic seizure. If the examiner is also going to ask you in a patient with the Lennox-Gastaut syndrome, in a patient with the Dravet syndrome, myoclonic seizure, Dravet syndrome, Lennox-Gastaut syndrome, in all of them, what is the drug of choice? Your all-time favorite will be none other than your sodium valproate. It is the most teratogenic anti-epileptic drug, guys, and associated with the spina bifida. I'm pretty sure all of you guys are already aware about this, that a patient of spina bifida or a baby of the spina bifida, when the baby is born, there will be, they will be born with a tuft of hair, or there will be exposed spinal cord. Okay, spina bifida. That is one of the teratogenic effect associated with them. All right, focal onset partial seizure. Focal onset seizure or partial seizure. What is the drug of choice? None other than your carbamazepine. This is also the drug of choice in a patient with the benign Rolandic epilepsy of childhood. Benign Rolandic epilepsy of childhood. The name of the drug is none other than carbamazepine. And not only that, it is also considered as a drug of choice in, it is also the drug of choice in a patient with trigeminal neuralgia and glossopharyngeal neuralgia, which was asked in the 2020 NEET PG examination. They gave a case-based scenario. A patient is having pain in the facial nerve, facial area, in a trigeminal nerve distribution. The pain is there on eating. The pain is there even on touch. Which of the following is the drug of choice? Carbamazepine was the answer. If you are following PYQ, you must have seen this question. Generalized tonic-clonic seizure, you can use lamotrigine, but other first-line drug like valproate you can also use. Okay, but again currently we are preferring this one more. Febrile seizure, you can use parectal diazepam. Parectal diazepam is the drug of choice in a patient with the febrile seizure. I'll be sharing this PDF to all of you guys for your quick revision. Okay, status epilepticus में what is the drug of choice wise? IV lorazepam is the drug of choice in status epilepticus. Infantile spasm, we can use ACTH. So 2021 INICET, this question was asked, infantile spasm, and there was another question that was on West syndrome, West triad. They always ask this question. Please don't forget that. I'll show you the question as well. Infantile spasm, if associated with the tuberous sclerosis, here we are going to use the name of a drug known as vigabatrin. Vigabatrin, boys and girls, it's a GABA transaminase inhibitor. It's one of the GABA transaminase inhibitor. And in 2020, the last aims before it was merged to INICET, they has a side effect of this one. They actually lead to your peripheral retinal atrophy. Peripheral retinal atrophy. Because of the peripheral retinal atrophy, there can be tunnel vision or tubular vision. Tunnel vision or the tubular vision. Anti-epileptic drug of choice in pregnancy that we have. What is the drug of choice, guys? Levetiracetam. Levetiracetam. Levi sounds like BV. Levi sounds like BV, and they are the one of the SV2A inhibitors. So इसके नाम में बहुत सारे resemblance है. देखिए क्या क्या resemblance है. Levi is like SV, and this sounds like also BV, right? So ऐसे याद करिए. Pregnant BV, anti-epileptic drug of choice in a pregnancy, right? And why am I using the term BV यहाँ पे? Because their side effect is similar to BV. क्या मतलब है इसका? ऐसा मैंने क्यों बोला? Because the most common side effect of this one, it is going to be somnolence. Okay, is it the only one? How does it resemble BV? No, this does not resemble BV. Other part resemble BV. That's a key. Aggression. याद करिए, इमेजिन करिए किसी की भी बीवी को, किसी की बीवी नहीं, अपनी बीवी को, अगर है तो, है ना, नहीं हो तो इमेजिनरी. एंगर, है ना, ऑलवेज एंग्री, ऑलवेज एग्रेसिव, एंग्जाइटी, ठीक है, ऑलवेज एग्रेसिव, एंगर, एंग्जाइटी, ऑलवेज एजिटेटेड, एजिटेशन, एंड इजिली इरिटेबल, इरिटेबिलिटी. तो इसीलिए मैंने बोला था बीवी को याद रखेंगे, सारी बातें याद रखेंगे. यू हैव टू रिकॉल अ बीवी. एसवी लेवी, इट्स अ ड्रग ऑफ चॉइस. एंड वाई बीवी? बिकॉज अग्रेशन, है ना, एंगर, एग्रेशन, एंग्जाइटी, है ना, ये सारे के सारे साइड इफेक्ट है किसके? लेवेटिरासिटाम के. ऑल राइट. सीजर ड्यूरिंग प्रेगनेंसी. सो इफ दे आर एक्चुअली टॉकिंग अबाउट एक्लेम्प्टिक सीजर, एक्लेम्शिया, एक्लेम्प्टिक सीजर की अगर बात करेंगे, इन दैट कंडीशन यू कैन यूज MgSO4. अनदर क्वेश्चन इन प्रेगनेंसी दैट दे वेरी कॉमनली आस्क इज a patient conceived, she was on an anti-epileptic drug. What is the next step that you should do? So the next step is that continue the same, do not change, because changing the anti-epileptic drug can cause precipitation of seizure, and that can be more damaging, that can be more dangerous. Okay, all right. So this was the question. Which of the following drugs are used in absence seizure? ये क्वेश्चन आया था, ये एम्स का क्वेश्चन है. ये 1, 2, 3, 2 and 3, 2 only, 4 only. What are the drugs that can be used in a patient with absence seizure? Carbamazepine, valproate, ethosuximide, gabapentin. I'll just quickly save some time here. The answer for this question is going to be 2 and 3 only. So as I said, absence seizure is important. Two things that you should know, that what is used and what is contraindicated. What is used, what is contraindicated. The drugs that are used, you can remember that you are getting absent from the class, that okay, I want to study, I'll get absent from the class, but you never study. तो करते क्या है, कुछ नहीं करते हैं, वेला घूमते हैं. You just roam around without any work, है ना. Getting absent from the class, क्या करने के लिए, पढ़ाई करने के लिए, but you never study, right? वेला घूमते हैं. Getting absent from the class stand for your clonazepam, valproate, ethosuximide being the drug of choice, एंड लैमोट्रिजीन. इसके सिवा और कोई ड्रग नहीं है जो कि एब्सेंस सीजर में हम यूज करते हैं. ठीक, they can there were few other drugs, that is T type calcium channel blocker, trimethadone and all. They were banned. We do not use it anymore because of the hemerolobby as a side effect. है ना, काफी पहले की बात है, तो हिस्ट्री की पुरानी बातों को मैं नहीं लिख रहा हूँ आपके लिए अननेसेसरी. हेमेरोलोबिया डे ब्लाइंडनेस जिसको बोलते हैं, दैट इज कॉज्ड बाय, है ना, that drug we do not use it anymore. Okay, ethosuximide being the drug of choice. Okay, what are the drugs that we have that are contraindicated in absence seizure? So you can remember, you have certain COPs that are coming at the TV. COPs at the TV stand for your carbamazepine, oxcarbazepine, phenytoin, any of the SV2A inhibitor. What is the SV2A inhibitor? Levetiracetam, brivaracetam. Okay, then tiagabine, vigabatrin, plus any other GABAergic drug. Any other GABAergic drug that we have, they will be contraindicated in absence seizure. The firing frequency in absence seizure is already reduced from a normal 7 to 8 Hz per second. In absence seizure, the firing frequency is already reduced to 3 Hz per second spike and wave pattern. Isn't that's the characteristic EEG finding in a patient with the absence seizure? Pediatric patient, poor scholastic performance, ये इनके फीचर होते हैं ना. Pediatric patient, there will be poor scholastic performance, है ना, and EEG finding will be 3 Hz per second spike and wave pattern. ठीक है, ये स्पेसिफिक फीचर होते हैं इनके एब्सेंस सीजर के. ठीक है, so the firing frequency is already reduced much lesser, right? There is no motor involvement in this one, and that is why these drugs, they can further precipitate the problem of the absence seizure. Okay, all right. A pediatric patient presented with the hips arrhythmia. Okay, 2022 as I told you, है ना. तो ये सारे टॉपिक हम पहले भी डिस्कस कर चुके हैं. दिस इज नॉट द फर्स्ट टाइम आई एम टीचिंग दिस ऑल टॉपिक्स. वी हैव डिस्कस इन प्रीवियस एंड उसके पहले भी, बट है ना कंसेक्यूटिवली अगर आप देखें तो टॉपिक सेम रह रहे हैं, क्वेश्चन आ रहे हैं. ठीक है, पीडियाट्रिक पेशेंट विद हिप्स एरिथमिया, सलाम स्पेल्स, विच ऑफ द फॉलोइंग एंटीएपिलेप्टिक द ड्रग ऑफ चॉइस. ओके, सलाम स्पेल, सलाम सीजर की बात कर रहे हैं, राइट. सो वी आर टॉकिंग अबाउट ACTH, राइट. ACTH की बात कर रहे हैं. ACTH विल बी द ड्रग ऑफ चॉइस इन दिस कंडीशन. ऑलराइट, Dr. Muthu, that's absolutely correct. Okay, ACTH is used in the treatment of 2022 NEET PG. Try to see, है ना. इससे आप एनालाइज करिए. एक एग्जाम में सेम ईयर में दिस क्वेश्चन इज बीइंग आस्क्ड, इन द अदर एग्जामिनेशन सेम ईयर दिस क्वेश्चन इज बीइंग आस्क्ड. सो व्हाट कैन यू एनालाइज that more or less the examiner's thinking is somewhat same, or maybe examiner is same, or examiner is having a similar kind of body, right? We can just make a guess out of this, right? So ACTH is used in the treatment of, because multiple topics are being repeated in both the examination. So in which situation? Juvenile myoclonic epilepsy, Dravet syndrome, Lennox-Gastaut syndrome, West syndrome. So West syndrome is the one that is correct, right? West syndrome is presenting with the West triad, right? That is usually having, this salam spell. There is mental retardation as well. Okay. And the first line drug of choice that we have is ACTH. Vigabatrin is also something that you can use. It's a GABA transferase inhibitor. Steroid and vitamin B6 is a supplementary drug that you can give. So these are the first line drugs. Second line drug में we have benzodiazepine, valproate, lamotrigine, topiramate, zonisamide, levetiracetam are all second line drug in a patient with the salam seizure or salam spells. Okay. All right. So as I was telling you, that another very important topic is non-epileptic uses of these anti-epileptic drugs. These are some major anti-epileptic drugs and they are non-epileptic uses. So do you guys know the non-epileptic uses of certain anti-epileptic drugs that we have here? For example, valproate. Of course, it's a drug of choice in certain epilepsies that I have already given you the list. But in this list, what I'm going to give you is their non-epileptic uses. So Quickly revise with me. Valproate, non-epileptic uses. It can be used for the prophylaxis of migraine. Okay, agreed. Where else? It can be used in a patient with the bipolar disorder. In a patient with a bipolar disorder, a condition comes that is rapid cycler, where there's a mania and depression is occurring more than 5 cycle per year. उसको बोलते हैं rapid cycler. Sorry, more than equal to 4 cycle per year. उसको बोलते हैं rapid cycler. उसमें it is the drug of choice. Lamotrigine, what is the non-epileptic use? Remember guys, lamotrigine के लिए. Where else we can use valproate? Any other use of valproate that you know? The non-epileptic uses. Prophylaxis of migraine, agreed. Bipolar disorder is one of the mood disorder. Okay, mood stabilizer. Yes, we can use meningococcus. Any other use? In a condition called Sydenham chorea, उसमें भी हम इनको यूज करते हैं. ठीक है. Lamotrigine, we can use them. Also in a bipolar disorder. Phenytoin, it's an antiarrhythmic drug. Phenytoin has no role in bipolar disorder, remember. It's an antiarrhythmic drug, class 1B antiarrhythmic drug, plus it also increase or improve the wound healing. It is also having wound healing property. It is also having wound healing property. Yes, we can use them in a patient with trigeminal neuralgia or glossopharyngeal neuralgia as well. Okay, carbamazepine, in fact, it's the drug of choice in a patient with the trigeminal neuralgia, glossopharyngeal neuralgia, and it can also be used in a patient with a bipolar disorder. What are the non-epileptic uses of other drugs like topiramate, zonisamide? Both of them, in fact, topiramate की बात करेंगे. Topiramate, it is actually known to cause weight loss. So it's an anti-obesity drug. It's an anti-obesity drug. I'm specifically talking about this drug known as topiramate. It's an anti-obesity drug. ठीक है. Okay, so here we have a slide that is asking topiramate का important uses. So remember, it's an anti-obesity drug. Undoubtedly, it's a anti-epileptic. वो तो सबसे पहला इसका है, वो हम कैसे भूल जाएं. So anti-obesity definitely is one of their important uses. They can be used in multiple type of epilepsies. AED, anti-epileptic drug. It can be used in generalized tonic-clonic seizure, partial seizure, or focal seizure, right? Lennox-Gastaut syndrome. In all these conditions we can use anti-obesity drug. Yes, in a patient with the bipolar disorder we can use. It is also used for the prophylaxis of migraine, right? And it also decreases the alcohol craving. So I used to say that this topiramate, it's a very holistic drug. Holistic. Why am I using the term holistic? Because it wears something called your topi. It wears topi and does all the good work. In the society, we need anti-epileptic drug of, for epileptic society, we need anti-epileptic property. It has anti-epileptic property, well and very nice. It is also going to act as an anti-obesity drug, bipolar disorder. It also reduces your headache, and last but not the least will be, it is also going to decrease the alcohol craving. So see how many good works it is causing in the society. As I was telling you, it's a very good drug. It's a holistic drug that is having holistic approach. Okay. All right. They are also associated with an important side effect that we have, weight loss, and they are also associated with the side effect known as your, एक तो weight loss side effect होता है और एक होता है renal stone. दोनों के साथ ये side effect है. This weight loss and renal stone, this is associated with both. But topiramate के साथ weight loss is statistically so significant that it is approved drug for obesity. It's an FDA approved drug for obesity. It can be used in obesity. है ना. Renal stone, nephrolithiasis, same word, doctor. Okay. A patient on reticabine therapy. Reticabine, guys, remember, it's a potassium channel opener. It's a potassium channel opener. So you never know. They can ask you this question as well, because it has already been asked in 2021. In the upcoming examination, they can ask you what is the mechanism of action of reticabine. The other name of reticabine is also ezogabine. Reticabine का एक और नाम होता है, इसका नाम होता है ezogabine. There is the same drug. It's a potassium channel opener. We are not using it commonly. It's a third line drug for the focal seizure, partial seizure, because of the pigmentation. They call skin pigmentation, retinal pigmentation. Bluish retinal pigmentation is one of the very, very important side effects. Bluish retinal pigmentation. It can also lead to skin pigmentation, eye pigmentation. सारे तरह के pigmentation कराते हैं. So if the patient is on reticabine therapy for focal seizure and phenytoin was added here, what will be the next step of management? This is the PYQ. So everyone knows that phenytoin is a very, very potent enzyme inducer, and all the inducers are known to cause treatment failure, right? So whenever treatment failure risk is there, you have to increase the dose of reticabine. Very good. Important point. Drug of choice for prevention and arrest of convulsion, दोनों के लिए, right? This will be none other than your diazepam. Treatment of choice for management of the acute alcohol withdrawal, so longer acting benzodiazepine, we call this one as a chlordiazepoxide. For resistant hypertension, we can use spironolactone, one of the aldosterone receptor antagonist. Drug of choice for renoprotective ACE inhibitors are the best drug. They are also considered as the best drug for decreasing cardiac remodeling or slowing down the cardiac remodeling. The answer for both the question is going to be same, ACE inhibitor. Treatment of choice for severe hypocalcemic tetany, calcium gluconate. This is a PYQ, has already been asked in one of the examination. And for treating trichomoniasis, metronidazole. This is also on the PYQ. ये CVS का part नहीं है, but just it came here. Actually, metronidazole आपको जानना है इसलिए because it is associated with the disulfiram like reaction. So a patient with the trichomoniasis given metronidazole, attended a party, consumed liquor, consumed alcohol, now having nausea, vomiting, flushing, headache, abdominal pain, and other symptom of disulfiram like reaction. So this question has been asked in the past. Okay. Which of the following drug is safe in a 42-year-old alcoholic patient with altered sensorium, liver enzyme altered है सारे, बताइए. So 42-year alcoholic patient, we always use short-acting benzodiazepine. So what are the short-acting benzodiazepine? How do we remember? I used to say that elderly patient अगर आता है या alcoholic patient आता है, तो you'll be saying Baba Leto. These are the Leto drugs. Baba Leto drugs, right? That is lorazepam, estrazolam, timazepam, triazolam, oxazepam, right? These are the Leto drugs, right? So lorazepam is the correct answer for this question. INICET 2022. Okay. Topiramate is used in the treatment of, so be very, very careful because it was asked in 2021 and here is the thing that I have already taught you here. Okay, be careful by choosing the answer. Please tell me. Topiramate is used in the treatment of migraine, heat prophylaxis, ADHD and Lennox-Gastaut syndrome. बस लास्ट के 2-3 एग्जाम के क्वेश्चन मैं दिखा रहा हूँ और टॉपिक पढ़ा रहा हूँ, so that you can remember that topics are often being repeated, है ना. उसी टॉपिक पे बार बार क्वेश्चन को थोड़ा रिफ्रेम करके आपको दिया जा रहा है. बताइए. It is used in the treatment of what? Treatment of migraine, heat stroke prophylaxis, ADHD or Lennox-Gastaut syndrome. Very good. All of you guys have given the answer, right? It's not used in the acute treatment of migraine. It is used for the prophylaxis of migraine. So many students got confused in this one and they have marked A as an answer. Now Lennox-Gastaut syndrome, it is characterized by recurrent epileptic episode and the drug of choice for this scenario that we have, it is going to be valproate. Other drug that can be used will be topiramate, zonisamide, felbamate, rufinamide. These are the drugs that have shown to be useful in a patient with the Lennox-Gastaut syndrome, which is characterized by recurrent epileptic episode. The patient should not be stopped from the drug. They should be continuously taking these drugs, right? Any stoppage, any missing of the dose can cause precipitation of the seizure. So this Lennox-Gastaut syndrome, it will go and it will say politely to valproate. It will say what it will say to valproate, that valproate तुझो फिर रुका. It is warning actually. Warning politely. Valproate को बोलता है valproate तुझो फिर रुका, right? मैं नहीं रुकूंगा. I will not stop if you ever stop. Valproate, you have to continue yourself. You have to be in my system always and always. Valproate तुझो फिर रुका, मैं नहीं रुकूंगा. So valproate, topiramate, zonisamide, felbamate, rufinamate, these are the drugs that can be utilized in a patient with the Lennox-Gastaut syndrome. Yes, ADHD में we can use methylphenidate as the drug of choice. मेथाडोन के बारे में बात कर ले थोड़ी सी. Let's talk a bit about methadone. It is used mainly in opioid de-addiction. Opioid de-addiction, right? So we call this one the MST, methadone substitution therapy. It's a longer acting opioid. It's a very long acting opioid. Okay. Most potent opioid will be your sufentanil. Sufentanil will be the most potent opioid. Do remember, if it is not there, you can even go ahead with the fentanyl. Because in one of the examinations, sufentanil was not given, right? Sufentanil is around 1000 times more potent, and they are comparing the potency with which drug? They are comparing the potency with the opioid, with the morphine. Okay, fentanyl is around 100 times more potent. Naloxone, it's an opioid receptor antagonist. It's an opioid receptor antagonist, and it is considered the antidote of opioid poisoning या opioid overdose. ओपियोइड पॉइजनिंग वर्ड आ जाए, ओपियोइड ओवरडोज वर्ड आ जाए, है ना, उसका एंटीडोट होगा. नैल्ट्रिक्सोन का क्या यूज होगा? नैल्मीफिन. नैल्मीफिन इज ऑल्सो यूटिलाइज सेम. दे कैन ऑल्सो बी यूज इन ओपियोइड पॉइजनिंग, ओपियोइड ओवरडोज और ओपियोइड पॉइजनिंग में दे आर यूज सेम एज नैलोक्सोन, नैल्मीफिन. एंड दे कैन ऑल्सो बी यूटिलाइज इन अ पेशेंट विद कोलेस्टेटिक प्रूराइटिस. कोलेस्टेटिक प्रूराइटिस. If I compare the same with the naltrexone, naltrexone is a drug that is used in opioid de-addiction therapy, opioid de-addiction therapy to prevent the relapse. So whenever there is a therapy called methadone substitution therapy, once you are done with the methadone substitution therapy, you will keep a 10-day opioid free period, and after 10 days of opioid free period, you will be starting this naltrexone. It's an opioid receptor antagonist, orally available, longer acting again. So it will be preventing the relapse, because in presence of naltrexone, even if the patient takes opioid, they will be ineffective. Okay, remember how many day of opioid free period is required before you are going to start naltrexone? 10 day of opioid free period is required. It also decreases the alcohol craving. That is another question. Not only that, it is also having anti-obesity property. So they are also used as an anti-obesity drug. I'm talking about a drug by the name of naltrexone. It's an opioid receptor antagonist. First choice of drug in OCD, panic disorder, PTSD, that is none other than drugs like your SSRI, like citalopram, escitalopram, fluoxetine, fluoxamine. Okay. Date-rape drug among benzodiazepine, flunitrazepam. It's an odorless, tasteless benzodiazepine. Flunitrazepam. So date rape drug, date पे rape, and after that he or she flew. ठीक है, डेट रेप ऑर्डरलेस टेस्टलेस बेंजोडाइजेपिन, आफ्टर दैट दे फ्लू. ऐसे याद रखिएगा कि रेप के बाद गायब वहां से, फ्लू, फ्लूनाइट्राजिपाम. इनवर्स एगोनिस्ट ऑफ बेंजोडाइजेपिन, दैट इज गोइंग टू बी बीटा कार्बोलिन. एल्बिमोपैन, इट्स अ पेरिफेरली एक्टिंग म्यू ओपियोइड रिसेप्टर एंटागोनिस्ट. पेरिफेरली एक्टिंग म्यू ओपियोइड रिसेप्टर एंटागोनिस्ट. Peripherally acting mu opioid receptor antagonist. They will be used for opioid induced constipation. They can be used for the opioid induced constipation. Now why are we using this one? Why can't we use naloxone? Because with the naloxone there will always be risk of withdrawal symptoms, right? Therefore they are peripherally acting mu opioid receptor antagonist. Albumin. There is one more by the name of naldemidine. Naldemidine, right? They are the opioid induced constipation. There is advantage that without precipitating withdrawal symptom. Without precipitating the withdrawal symptom. That is the advantage of this peripherally acting mu opioid receptor antagonist. Okay. Drug of choice, I think I have told you already this one. Then you should know antidepressant. What are the antidepressant that we have under SSRI? Chef drugs, citalopram, escitalopram, fluoxetine, fluoxamine, paroxetine, and sertraline. PDF I will post after the class. Okay. The side effect that we have, you can remember side effect also by the same mnemonic of SSRI. SSRI के side effect will be remembered by the mnemonic SSRI. They will be causing serotonin syndrome. Serotonin syndrome, where there will be nausea, vomiting, headache, flushing, fall in the blood pressure, diarrhea. All of them will be feature of serotonin syndrome. They can even lead to sexual dysfunction. In the sexual dysfunction, they can lead to delayed ejaculation. That is why, in fact, FDA has approved this class of drug for premature ejaculation, restlessness, and insomnia. So याद रखिएगा, SSRI का side effect is none other than your SSRI. And what else that you know, that these side effects that I have mentioned, it is also seen in the SNRI. Sexual side effect can also be seen with the TCA, but more common it is going to be with SSRI. Next in the order will be SNRI, TCA के साथ कम होगा, right? SNRI, they are the serotonin noradrenaline reuptake inhibitor. You can remember very easily. Venlafaxine sounds like vanilla, a very good ice cream. Vanilla duals my love. Duals, that means it is going to dual out the two neurotransmitters serotonin and noradrenaline. Vanilla duals my love. Say it again, vanilla, venlafaxine. And one of the congener of the venlafaxine, desvenlafaxine. Duloxetine, milnacipran, levomilnacipran. So vanilla duals my love. Imipramine, trimipramine, these are all the TCA drug, and they are used as second line drug in depression, not the first line drug, because of their multiple side effects. For example, they are having alpha 1 blocking property. Because of that, there will be fall in the blood pressure. It can also lead to reflex tachycardia as a side effect. Their side effect is same as SSRI. They also are going to have anticholinergic side effect. Therefore, there will be blurring of vision, dryness of mouth. They can also lead to urine retention. They can also lead to constipation. Very common side effect, anticholinergic side effect. Okay. They also will have antihistaminic property. Because of that, they can cause sedation as well. Then they will also be having another problem called metabolic acidosis. They also can cause metabolic acidosis, and this metabolic acidosis can also lead to arrhythmia. Metabolic acidosis can also lead to arrhythmia. Okay. Cardiotoxicity is additional side effect that is mainly associated with the venlafaxine. Venlafaxine के साथ cardiotoxicity also दिख सकता है. Okay. Drugs causing least sexual side effect. So fluoxetine is a SSRI, definitely it can cause. Venlafaxine, SNRI, definitely it can also cause. Mythazepine and imipramine. Imipramine is a TCA. So as I said, that any drug that is increasing the level of serotonin, noradrenaline at the synaptic cleft, they can cause. Mythazepine is a receptor modulator, so they will have a least risk of sexual side effect. It's a receptor modulator. 65-year patient presenting with the rigidity, tremor, bradykinesia, and masked facies. So they are actually talking about which disease, which of the following agent will be given. So rigidity, tremor, bradykinesia. Triad किधर जा रहा है? Parkinson's disease. So which of the drug can be given? Selegiline. The diagnosis here is going to be Parkinson's disease. Drugs causing disulfiram-like reaction. Remember, it's also not very difficult. You can remember by the very simple mnemonic of Government Medical College of Madhya Pradesh and Chhattisgarh. Here you can see ये alcohol वाले side effect. Disulfiram-like reaction will be seen due to inhibition property of enzyme known as your aldehyde dehydrogenase. Aldehyde dehydrogenase inhibition will be causing increment of acetaldehyde. है ना? So we have Government Medical College में griseofulvin and antifungal drug, griseofulvin, metronidazole, and cephalosporin that we have like cefoperazone, cefotitan, cefomandole, moxalactam, procarbazine, an anti-cancer drug, and chlorpropamide, a first generation sulfonylurea. So we are having Government Medical College, Madhya Pradesh, Chhattisgarh. These are all the drugs that can cause disulfiram-like reaction. आपको देखना होगा case based scenario can be asked, है ना, very frequently asked. Okay, antihypertensive regimen we will see first and foremost. Let's do a question. A hypertensive patient is planning to conceive. Which of the drugs should be stopped before conception? Before conception, which of the following antihypertensive drugs should be stopped? Guys, remember ACE inhibitors. So in the hypertension in pregnancy, two important questions that are asked very commonly. Which of the following is a safe antihypertensive drug in pregnancy, and which of the following is unsafe, therefore that should be avoided? So what is a safe antihypertensive drug? in a pregnancy, the safe antihypertensive drug, I used to give you the mnemonic that do remember that Lady Harding Medical College is very, very safe. Lady Harding Medical College is safer for the female. Okay? So the drugs under this one that we have is labetalol. Labetalol. It's the drug of choice. Very good, Dr. Muthu. Harding will be hydralazine. Potassium channel opener can also be used. Alpha methyl dopa and also clonidine can also be utilized. Also safer drug. College will be your calcium channel blocker. Please remember, calcium channel blocker we will be preferring DHPs. All those names are ending with the dipines. And cardioselective beta blockers. Cardioselective beta blockers like atenolol, metoprolol. These are the drugs that can be utilized, or these are the drugs that we have that can be utilized safely hypertension in pregnancy, in hypertensive patient with pregnancy. What is avoided? So I would say always that in pregnancy you can go to Lady Harding Medical College. Okay, they are safe, but I would say avoid DNB. Just a way to remember, avoid DNB. Avoid DNB stand for your all the ACE inhibitors, ARBs, the diuretics, sodium nitroprusside, non-DHPs like your verapamil, diltiazem, and beta blockers. So what you know about which beta blocker? The non-selective one. Which beta blocker should be avoided? The non-selective ones should be avoided. So avoid DNB. क्या avoid करना pregnancy में? You have to avoid DNB. Avoid DNB colleges. ACE inhibitors, ARB, diuretics, sodium nitroprusside, and beta blocker. The non-selective beta blocker. And Lady Harding Medical College are the drugs that can be utilized. Okay? So again, CCB में non-DHPs like verapamil, diltiazem are something that can be that can be teratogenic, so it should be avoided. Okay. Antiarrhythmic that we have, Vaughan-Williams classification is the name. Vaughan-Williams classification. Vaughan-Williams classification. Everyone knows this one. This is not a very difficult one like class 1, class 2, class 3, class 4 and all the other antiarrhythmic drugs. Class 1 will be mainly your sodium channel blocker. 2 will be beta blocker. B is the second letter, you can remember also like that way. 3 will be potassium channel blocker. 4 will be your calcium channel blocker. The sodium channel blocker agent that we have are further subdivided into different types. These are further subdivided into class 1A, 1B, 1C depending on their additional activity on the potassium. All of them are sodium channel blocker. Along with sodium channel blocker, these are also potassium channel blocker. These are actually having potassium channel opening capacity. And the other one that we have, the last one that is the class 1C, they have no effect or they have very lesser effect on the potassium channel. So what are the drugs that we have in class 1 antiarrhythmic drug? Important one you should know, right? We are having drugs like your quinidine. They will ask you to identify. They can ask you to identify quinidine, procainamide, and disopyramide. Quinidine, procainamide and disopyramide. This is sodium and potassium both blocker. This is sodium blocker, potassium channel opener, right? So this you can remember that they are just opening the potassium channel. B for Bahar, they are just outside the door, and they always say that I am so important that they all like to phone me. I am very, very important person of this family. All like to phone me is lidocaine, tocainide, phenytoin, and maxilitine. Right? They all like to phone me. I am very, very important. In fact, they are important in a sense. The lidocaine is the drug of choice in most cases of ventricular tachycardia. They are also the drug of choice in a patient with the digoxin-induced ventricular arrhythmia, digoxin-mediated ventricular arrhythmia, or digoxin-induced ventricular arrhythmia. Okay, class 1C antiarrhythmic drug. What are the 1C drugs that we have under 1C? flecainide, propafenone. Their name is like propranolol. So they also have additional beta blocking property. Which one? Propafenone. Which of the following antiarrhythmic drug, class 1 antiarrhythmic drug, have beta blocking property? The name of the drug is propafenone. Okay, propafenone. Morphine. Right, these are the drugs that we have under class 1C antiarrhythmic drug. So 1A antiarrhythmic drug, 1B, 1C, you have to remember. And how are you going to remember? That 1A, they are very important. Important in the sense they are A group of people, and A grade, A group of people in a society, they always stay in a A grade facility. So these are your queen, prince and a dasi. They always stay together, travel together. B, they are bahar. They are not in A grade, but they are bahar. They are not coming in those area, but they are bahar, and they are having a lot of pride in themselves. They say that I am so important that they all like to phone me. Even queen, prince and dasi, they like to phone me whenever there is a ventricular arrhythmia. So like to phone me, lidocaine, tokainate, phenytoin, maxilitine. Phenytoin is an anti-epileptic drug having antiarrhythmic property. C वाला कौन सा होगा? That we are doing all the C grade work of this kingdom or this society, right? वो जो kingdom, जो king वाली society थी उसमें floor पर mopping etc. that is your encainide. Floor पर mopping etc. So say it again. A grade, queen, prince and dasi. B, they all like to phone me. C, that is floor per mopping etc. Floor per mopping etc. Very easy to remember. B is a beta blocker. Everyone knows that, right? Atenolol, metoprolol that we have. Potassium channel blocker, we have many drugs. Important one that you should know is amiodarone. Please do not forget about amiodarone, and also do not forget the side effect of amiodarone. जैसे कि they will be causing QT prolongation. They will be causing thyroid abnormality that can go in either direction. They can cause pulmonary fibrosis. There are many side effects. Only important ones I am writing, right? Corneal microdeposits. Corneal microdeposits. Please don't forget this. They are very frequently asked one. Calcium channel blocker में we have verapamil, diltiazem. Verapamil and diltiazem. Then we are having other drugs under this one. We have drugs like your magnesium, right? Adenosine, है ना? Magnesium, adenosine, digoxin, atropine. ये सारे के सारे other या miscellaneous group of antiarrhythmic drugs में आते हैं. ठीक है? Now examiner asks that which of the following is going to cause QT prolongation? Which one will be causing your QT prolongation? So antiarrhythmic drug causing QT prolongation. So the one that is causing QT prolongation will be any drug that is having potassium channel blocking property. So class 1A will be causing QT prolongation, and also class 3 antiarrhythmic drug will be causing QT prolongation. How can you see this one? If you are going to look at class 1A antiarrhythmic drug, इनके effect देखेंगे. So examine in 2022 अभी जो exam हुआ था इसमें they gave this image as well and they asked. So let me see if I can do justice to this topic. So let's say this is one of the action potential, normal action potential duration. And the one that is going to cause the QT prolongation that we have, if it is class 1A antiarrhythmic drug, it will be sodium channel blocker. If it is class 1A, it is going to cause sodium channel blockade. And because of sodium channel blockade, there will be decrease in the slope of depolarization. There will be decrease in slope of depolarization. Plus, because of the potassium channel blockade, the repolarization will also take some time. So whenever something like this, you are going to get a graph, something like this will be mainly associated with class 1A antiarrhythmic drug. Right? So what are the class 1A antiarrhythmic drug? I think I have already told you. Quinidine, tocainamide, disopyramide. On the other hand, if you are going to see class 3 antiarrhythmic drug, how can you recognize and identify this? Let's say this is again one normal, let's say, action potential duration that we have. And if it is going to be class 3 antiarrhythmic drug, so it has no effect on the slope of depolarization. So slope of depolarization will be absolutely fine. It will be normal. But because it's a potassium channel blocker, there will be increase in the QT interval. Okay? So please remember and know how to identify this one. This is a class 3 antiarrhythmic drug like amiodarone, right? Ibutylide, sotalol, है ना? These are the class 3 antiarrhythmic drug. They will be causing mainly your QT prolongation. I hope you can remember it very easily, है ना? We have drugs like your amiodarone, sotalol, ibutylide, है ना? Dronedarone, dofetilide, all those drugs are class 3 antiarrhythmic drug. Which of the following antihypertensive drug can cause this one? So what you see here is the angioedema, and angioedema is very frequent side effect of the lisinopril. It's a bradykinin mediated side effect. Which antihypertensive drug causes Coombs positive test? Guys, this will be your alpha methyl dopa, right? Autoimmune hemolytic anemia की वजह से there can be Coombs positive. It can even lead to other side effect like which antihypertensive drug is going to cause nightmares. There will also be development of extrapyramidal symptom, alpha methyl dopa. It's actually a preferred drug mainly for chronic hypertension in pregnancy. For chronic hypertension in pregnancy, we are going to prefer this class of drug. Renin release inhibitor will be beta blockers. Remember, beta 1 blocker. But if the examiner is going to ask you which of the following is a renin inhibitor, so their answer will change to other drug, that is your aliskiren. Right, aliskiren. Dr. Rushabh, anakinra is an interleukin 1 inhibitor. उसका इससे कोई लेना देना नहीं है. It's an immunomodulated drug used in rheumatoid arthritis. It's an interleukin 1 inhibitor. Dr. Rushabh Rahul Kataria, most common side effect of this inhibitor will be dry cough. ARB having anti-aggregant property, platelet का aggregation को inhibit करता है. ARB that can decrease the uric acid level. ARB that can also decrease the LDL level. ARB that is having the lowest T half life. सबके नाम में low word आएगा. That is none other than your low sartan. Everything will be lower. Lower T half life, lower platelet activity, lower uric acid level, and lower LDL level. That is none other than your low sartan. Okay. So these all we have done already. So important points. A couple of more that we have. Amiodarone. Side effect of amiodarone I have already told you. Levosimendan. What are they? They are the phosphodiesterase 3 inhibitor. They are also given the name as the inodilators. So we have other drugs under same, that is ambrinon, milrinone, levosimendan. In which patient it will be utilized? It will be utilized in a patient with a heart failure. Heart failure patient में, in a patient with a congestive heart failure patients में we will be using them. Most common side effect of digoxin will be nausea and vomiting. Mechanism of action will be sodium potassium ATPase inhibitor. This is the direct mechanism of action. Indirectly, it will be increasing the intracellular calcium. Most common side effect will be nausea and vomiting, but the specific side effect will be xanthopsia, which we call it as a yellow vision. तो अगर vision yellow दिख रहा है patient को, that is possibly due to, है ना? That is possibly due to digoxin. Okay. Then trimetazidine, ranolazine. Remember, trimetazidine, ranolazine. They are the fatty acid oxidation inhibitor. है ना? If you want to burn your fat, try running आज से ही. If you want to burn your fat, what you will do? Try running आज से ही. Ranolazine, on the other hand, there is an additional mechanism of action they are telling. That is the main mechanism of action of ranolazine will be late sodium influx inhibitor. They are mainly utilized in a patient with angina. Please don't forget this. Fasudil, it's one of the Rho kinase inhibitor. Fasudil is one of the Rho kinase inhibitor. I want you to remember that Fasudil sounds like फंसा हुआ दिल, और जो फंसा हुआ दिल रहता है वो रोता रहता है. It keeps on crying. So Rho kinase inhibitor Fasudil. Fibrate having uricosuric. Please remember that fibrate is one of the PPAR alpha agonist. That is question number 1, like fenofibrate, bezafibrate. The one having uricosuric property, it will be fenofibrate. Antidisturbing drug of choice will be your none other than bile acid sequestrants. Like your cholestyramine, cholestypol, cholecyvalam. These are the bile acid sequestrants. इनका दूसरा नाम होता है resins. Resins are the other name of this class of drug that are used as a drug of choice in these patients. Okay. This I have already told you. ये वाला हो गया. Diuretic contraindicated. Loop diuretics are contraindicated in a patient with hypocalcemia. Severe hypocalcemic tetany, ये भी मैं बता चुका हूँ. Iron deficiency में iron supplement we have discussed in the previous slide. Okay. Best agent for increasing HDL. This is the last point and this is the last thing that I will be discussing, and then we will be done for the day. Best agent for increasing the HDL level, that is none other than your niacin. To decrease the triglyceride level, that will be your fibrates that are going to act via nuclear receptor PPAR alpha agonist, and that will be increasing the level of lipoprotein lipase. The one that is associated with the flushing, pruritus, maculopathy and increasing the uric acid level, it is none other than again niacin. Niacin is the drug here. Okay, niacin is the drug in that condition. All right. Let's do the question before we end the session here. A patient presented with ventricular arrhythmia, ECG shown. So ECG में बोला कि this is one of the NEET PG 2022. So a student said, sir, ECG was very clearly evident of ventricular tachycardia, and what is the drug of choice? ECG shows the shows below. So ventricular tachycardia का feature था. What is the drug of choice? IV amiodarone, IV metoprolol, oral amiodarone and oral metoprolol. Go ahead please. What do you think is the correct answer for this one? In a patient presented with the ventricular tachycardia and ECG also suggestive of ventricular tachycardia. मान लीजिए diagnose हो गया, ठीक है? What is the drug of choice? IV amiodarone, IV metoprolol, oral amiodarone or oral metoprolol? A, IV amiodarone. Okay. Other students please. A. Okay, great. Now let's see very quickly. In a patient with a ventricular tachycardia, okay, ventricular tachycardia, we are having lidocaine. If it is not there, the other best choice that we have is amiodarone. In fact, amiodarone is the drug of choice of ventricular tachycardia in a MI patient. Okay. Okay. Now let's see the algorithm that we have for the management. If there is a ventricular tachycardia, find out if there is an electrolyte imbalance. Correct the electrolyte. If the patient is hemodynamically unstable, then you are going to do direct current cardioversion, DCC, if it is hemodynamically unstable. Okay. Look for, if the QT interval is normal, then in that case scenario, in that case scenario also look for ejection fraction, whether it is more than 40%, less than 40%. If it is less than 40%, then we are going to use amiodarone lidocaine. If it is more than, then you can use procainamide, sotalol, lidocaine and amiodarone. Sotalol is a beta blocker. है ना? Prolonged QT interval है, then you are supposed to again discontinue the drug that is possibly causing this QT interval prolongation. Since there is no history, there is nothing about QT interval prolongation, we are not going to stop, or we are not going to rule out our amiodarone here. So again, the first line drug that we have for ventricular tachycardia, lidocaine or amiodarone. So correct answer as you have given is correct. Amiodarone is the correct answer for this question. Last question for the day will be this one. Which of the following is correct match? 2022 का क्वेश्चन ध्यान दीजिएगा. Correct match with this adverse effect. Atenolol, hemolytic anemia, hydralazine, heart failure. So which one is the correct? Which one do you think is correct? Verapamil mediated constipation, aliskiren mediated hypokalemia. See, any of the renin inhibitor, one thing that you should know, any of the renin inhibitor, or let's say RAS system inhibitor, any of the RAS system inhibitor, be it renin inhibitor, ACE inhibitor, ARB, aldosterone receptor blocker, any of these, they will always and always be associated with hyperkalemia. आज ये चीज को नोट कर लीजिए. Any of the RAS system inhibitor, they will be associated with the hyperkalemia. Here, if the examiner is going to ask you that which side effect is correct, verapamil mediated constipation, this is the correct one. DHPs, non-DHPs, whether there is a non-DHPs or there is a DHP, one side effect that is common will be constipation. Constipation is a common side effect that will be seen with both of them. Okay? So this will be everything which I wanted to discuss with all of you guys in our today's session of cardiovascular system and central nervous system. We did extended the session for a bit, but I hope that you guys were able to revise some of the important areas of of this important topic that we have, central nervous system and cardiovascular system. Okay. Tomorrow I'll be yesterday I have already discussed ANS and general pharmacology, some important areas I have covered. Tomorrow I'll be taking care of other areas like autocoids, endocrine, hemat. These are the areas tomorrow I'll be taking care. And on the day 4, that is day after, again at 7 p.m. I'll be meeting with all of you guys every day at 7 p.m. You can get the link in any of my social media handles, in any of my telegram group link, और Unacademy का जो telegram group है वहाँ से भी आप ले सकते हैं. You can search it out, you can easily find it. Okay, so at 7 p.m. every day I am coming live to discuss with all of you guys the high-yield topic. This session is free for all, and it is highly effective class and highly recommended session for FMGE students and NEET PG students as well. Okay, I'll be sharing the PDF in a moment after some time. Please do the revision and see you all tomorrow at 7 p.m. Thank you very much to all of you. Have a great day. Good night. Great day. Good night. Thank you.